And residents of Baringo County have borne the brunt of heavy rains, which have now led to an outbreak of malaria.
Tiaty sub-county is worst hit, with almost 40% of its population affected. The county administration confirmed that 2 people lost their lives in the last month to malaria.
Now, the government, through the
Kenya Medical Supplies Authority, KEMSA, has stepped up efforts to reduce the malaria burden in the country through massive distribution of long-lasting insecticidal nets in over 20 malaria-endemic counties.
That's right. And as our very own Serafine Ochieng Ouma reports, more than 290,000 nets were distributed to residents of 3 sub-counties in Baringo. Take a listen.
Baringo County, which harbors Lake Baringo, is classified as a malaria high-burden county, an infectious disease commonly associated with wet places. Even though the landscape is dominated by savannas, seasonal rivers traverse the region's rocky valleys, and when it rains heavily, floods become commonplace, forming perfect breeding grounds for the female Anopheles mosquito, which is not only a nuisance but a threat to public health.
A month ago, we had some fatalities in our Baringo County Referral Hospital, whereby we lost 2 lives due to malaria. And currently, we also have some upsurges. We are currently managing.
We have identified Tiaty West. There's a bit of upsurge of malaria. We've sent our team. They've done the testing, and they found that almost 40% of that population has malaria.
In Muserech area in Eldama Ravine sub-county, we find Yvonne Yagan busy trying to drain the stagnant water next to her homestead in vain. This has been the situation since the last time it rained heavily, a trend that is now a great concern.
Changamoto hapa ikinyesha maji na flood, ndio mosquitoes wanakuwa wengi, ndio sasa malaria inatufamia.
Sasa kama mtoto akianza kukonjeka, tuseme hiyo joto, hiyo kutabika, hiyo kukosa hamu ya chakula. Sasa hivyo sasa ndio tutaenda hospitali.
The mother of 3 explains how the frequent hospital visits have taken a huge toll on this family.
Sasa tukienda kama dispensary tusipopata dawa, tunaenda private. Sasa tukifika, labda tuende lab, labda tuambiwe sasa tununue dawa, lazima tutumie more than 2,000 per visit.
A government program funded by Global Fund seeks to avert the health and economic crisis for vulnerable families like Yagans through the distribution of long-lasting insecticidal nets. Speaking during the flagging off of the nets at Muserech Dispensary, Baringo County Deputy Governor Felix Maio said that 3 sub-counties with a population of over 470 people are set to benefit.
The reasons why we've launched here in Eldama Ravine, or why Eldama Ravine was selected because of the island malarias, and also we have Baringo South because of the irrigation schemes in Baringo South, and Mosquito because of the data or the figures coming out in terms of the malaria prevalence in that area.
We have flagged off 298,000 pieces, and we believe that all the intended households who are mapped to receive the commodities are going to receive.
Speaking at the Kenya Medical Supplies Authority depot in Nakuru town, the authority's CEO, Wako Dulacha Ejersa, said that the program, which began in January 2024, targets about 20 malaria-endemic counties through an investment of about 10.9 million shillings.
LLIN is a big intervention that will go a long way in saving lives of our children and pregnant mothers and everyone actually in the affected counties. So as a country, we have targeted 18 counties. Mainly KEMSA is involved in the last mile distribution.
According to the Kenya Malaria Indicator Survey of 2020, Kenya's national malaria prevalence stands at 5.8%. The country records an estimated 3.5 million new clinical cases and 10,700 deaths annually. The national distribution of mosquito nets comes as a relief to families in malaria-endemic counties like Yagans, who can now afford peaceful nights free from mosquito bites. Safin Acheng Oma, Citizen TV.
As the world marks